Okay, I'm just going to move everyone's faces. So during this presentation, we're going to go through the DfE's new, their new program for supplying home test kits to all staff that are working in school with children. So this doesn't count for those that are working at home. Sorry, this isn't for adults that are working from home and not coming into school. So this is for everyone that works face-to-face with children in school. So who is being tested and why? So testing is important because staff could be carrying the virus and may spread it to others. Testing staff without symptoms will support schools to continue to operate. It's estimated that currently 1 in 3 people have the virus. Simple and quick tests using the antigen lateral flow devices. So as we go through, we will refer to these as the LFD tests. Enable rapid testing of staff from their home without the need for a laboratory. Home testing gives all staff who take part the reassurance that they are well and not transmitting the virus unknowingly to others. Testing will help break the chains of transmission if we carry out this testing twice weekly at home, with about 3 or 4 days apart and before coming into the workplace. But we still need to make sure we are maintaining that message of making sure we have got clean hands, wearing our face coverings and keeping 2 meters social distancing. So having these tests do not mean that those things still do not remain in place. So how will it work? Our tests have been delivered today and they will be ready for collection from anybody that wishes to take part in this program from tomorrow in the leadership suite. And then the official testing will start on Sunday evening and test results can be recorded on Monday. The allocation of the test will be issued to staff to record on a test log, and those test records will be kept in school. You will be given enough tests to cover 3.5 weeks, and then we can request more tests after that. The test kits do come with full instructions in the box. However, the government haven't been able to supply the right instructions in the test, so you will be given this test instruction to go with your test. The ones in your box have got a little lady on the front. We need to make sure you are following these test instructions, which are the correct ones. There will be a video demonstration for you to be able to watch. I have put it on this PowerPoint so it will be sent out and you can watch that at home, and it will give you full instructions on how to administer the test and what you need to do in the test environment at home to make sure that you don't contaminate the test kit. I do want to make it very, very clear that this testing is optional. It is not compulsory for all staff. So if you wish to opt into it, you do need to stick to the testing regime of testing twice weekly for those that are in full-time, and for those that work part-time, that you test the night before you're due into work, but I will cover that more in a few slides. Sorry, I'm just allowing some people in. So they are suggesting that the staff test before they attend work. So for those people that do work Monday to Friday, we recommend that you test Sunday evening because you will have your results within 30 minutes. And then on a second evening, we recommend Wednesday would be good in the middle of the week. For those that aren't in every day, as I just said, we are asking that those members of staff will test the night before they are due into work, and you won't need to test again that week. So you will only need to do one test a week. As I just said, you will get your results within 30 minutes and you will need to report the result each test to the NHS Test and Trace, and you will need to also report that to the school, and I will cover how we report that in a moment. And as I said, the testing packs, the test instructions are in your kit, and I stupidly nominated myself to be the COVID testing coordinator without actually having any clue what it involved. So that is me. Here's the video. It's 7 minutes long, so we won't watch that now, as it literally just covers how to administer the test. So before taking the test, there are a few things that you will need to do. There will be a privacy notice that will be emailed around and a paper copy available when you collect your test kit, should you choose to opt in. Please make sure you read that and understand how and why your data is used and what it will be used for. That you read this test instruction carefully, not the one in the box, and you've watched the video that we will email round with the PowerPoint as well. And before you take your test kit, you will need to make sure that you have signed the school tracking form and also understand that you will have the responsibility to report to us your test results, whether that is positive, negative, or not valid, but I will come to those in a moment. Please remember, if you've got any questions, put it into the chat and we will look at those at the end. So the test outcome, unfortunately, these are the nose and throat ones. So you will need to administer the test. Then in the test box, there's a little tube. The cotton bud goes in, the swab, sorry, goes into the tube. Twizzle it around for a bit. Obviously, please read the instructions and don't go by mine. And then you put it onto the small cartridge, which looks like this, in your test box. You need to wait 30 minutes. Reason being, oh, sorry. Please do make sure you wait 30 minutes. I've taken a number of these and they can show positive first, but as the specimen, if you like, works its way up the device, it will then work itself out. So please wait 30 minutes before you have a look. So on your device, there will be a C and a T. You will always have a red mark next to the C. That means that it's a control and it means that the test is being administered properly. If you test negative, you will only have one red line and that will be next to the C. If you test positive, you will have a red line next to the C and next to the T, which indicates that it is detected the target. And that line can be really, really faint, or it can be quite dark red, the same as the C line. If your test is invalid, the control line will not have a mark, the red line there, but there may be a line next to the T. If you get a invalid result on one test, you will need to retake that test, and the instructions on how and why to do that is all in your blue booklet. So what to do if your result is negative? You are safe to come to work. However, before you come to work, you will need to log on to the NHS self-testing website to record your result. The process to do that is really, really easy. It's pretty much exactly the same as if you are applying for your car tax and things like that online. You just put your name in, the code that's on your test and the results from the test. But it's really important that those things are logged on that website. And when you come into school, you will also need to notify the school. So that we can do this safely and in a manageable way, we've decided that there will be a folder set up in the school office that will have a big sign on the front that says COVID testing. In there will be a sheet with everyone's name on. We ask that you put the date that you did the test and then just indicate whether it was a negative or a invalid result, because then I can then transfer it from that sheet onto the spreadsheet we need to keep as a school. Reason being is that helps us track in-school testing that's taking place, as well as being able to manage how many tests are within our workforce and whether we need to start ordering any more. But it's really important that you record that result on the NHS website, as well as informing us in school when you come back in. If your result is positive, you must stay at home. You must, again, log that result on the Test and Trace website. that I just spoke about. Just so that we're not confusing things, as we always have done, please make sure you notify Dora or Joe immediately of your result that you've tested positive. You must then arrange to take the PCR test, which is the one that's done at the testing stations, so that that can confirm your result. And you must then begin your 10 days self-isolation and inform anybody else in your household and your bubble that they need to do the same. When you receive the result from your PCR test, you need to report that result to school, as you do anyway, so that we can then use that result to decide which members of staff we need to inform to self-isolate and or close the bubble. However, if the PCR test is negative, you may then come back to work and your household can stop self-isolating if you feel well enough to do so. If your result is inconclusive, so it's not valid, you then need to take a second test. This could be that you didn't collect enough sample in your throat or nose, and you need to report the outcome again to the NHS Test and Trace online, as well as in the testing log folder that will be in the office, in the main school office. Again, even if they are invalid, we still need to record those results both in school and for the NHS. This can be, again, so that I can kind of keep track to make sure that we haven't got a dodgy batch or there's any issues with the testing kits as a whole. So there's just a little bit there about how to report your results, just to make sure that we're doing that, and reiterate that as we go through. If you don't want to report it online, you can do it over the telephone, but I've just sat for 45 minutes on the helpline, so I suggest you do it online. It will be a lot quicker. Just going to go through some questions. These aren't questions from school, as there are some random ones. These are from the NHS documents that have been sent round to us. So I will just go through some of these. So, do I need to test myself if I'm working from home? So as I said earlier, no, only if you are coming into school. You need to, if you want to, you can take part in the testing. If you have had the COVID vaccine, do you still need to test yourself? Yes, because whilst they have seen positive results from the vaccine, they can't guarantee that you can't still carry the virus and spread through that way. If you are pregnant, yes, or clinically vulnerable, these tests are still safe for you to take. Can you eat or drink before the test? They suggest taking the test in the morning before eating and drinking. However, in your document, it does say you can take it at any point throughout the day, but they advise that you don't eat for 30 minutes or drink for 30 minutes before taking the test. We've discussed as an SLT and feel for logistical wise, it would be easier if staff could take the test on a Sunday evening, again, if you work full time, or the night before you're due into work, as late in the evening as you can, so that you're not in contact with anybody else, so that we can be informed and then make any staffing decisions and bubble closures sooner rather than later. Can you use the test kit for anybody else? Absolutely not, I'm afraid. So these test kits are purely for staff use only, and they will be monitored in terms of how many tests have been used, because we've got that log in school, as well as the test and trace having that log as well. So these are only for school staff, I'm afraid, not for anybody else in your house. If you don't want to take part in the program but then change your mind, yes, you can have the tests. You will just need to make sure you come and speak to me, so that I can allocate you and give you those test kits and fill those in. If you have a cold or a runny nose, can you still do the test? Yes, because you will need to blow your nose gently, and it does stipulate gently because obviously it will need some mucus to use for the sample. So there's a little bit of info there. If you've got your nose pierced, yes, you can still do it. Again, there's some guidance there. I won't go through all of these. This is probably my favourite one. If I'm not a morning person, which is me, or I have too much to do in the morning, can you do it in the evening? Yes, you can. So that would be okay. So what do we need to know for us, just to kind of summarise and go back over? Testing will officially start in Monday, but you can start collecting your test kits from the Leadership Suite tomorrow, should you wish to take part. You will need, we will share the privacy notice this evening and a staff training declaration form you will need to sign after this session, should you wish to take part when you collect your test kit. And by collecting this, you are agreeing that you will report your test results to the NHS before attending work, and you will let the school know as well of a positive test result, as you do anyway, but also signing that folder with your test results there as well. Obviously, please don't, you won't need to fill it in if it's positive, because as much as we love to have you in school, we won't want to see you for 10 days. Any other questions? I just want to say before I go, okay, someone's already put it in there, that's fine. So just going through these questions. So do staff need to do this if they have tested positive within 90 days? I have phoned the DFE to clarify this. They say Public Health England have advised no. So if you have tested positive recently, you will have had numerous text messages and emails from Test and Trace, and one of those will say, don't get a test for 90 days. What they are saying for school, so they then spoke to the Department of Health, and the Department of Health have decided that for any school staff that have tested positive within 90 days can take part in this mass testing program, because they are unclear whether we can still have the virus after 10 days and are then obviously causing more transmission. So if you have had COVID within the last 90 days, yes, you can take part. If you get a positive result, you will need to book yourself a PCR test. If the PCR test come back negative, you're fine to come back to work. If the PCR test come back positive, then, as many of us have already said, we could still be infectious. So then you will need to start your isolation for 10 days then. There's another one. It says nose or throat. Do we need to do both? As far as I'm aware, it does say both in the booklet. But please do make sure that you read it just to make sure. I will just have a quick look now. Just quickly glancing at this, it does say that you will need to do both, but there's Dora giving wrong information. But please do read it, the instruction booklet, properly. That was just me having a very quick glance at it. Has anybody else got any other questions before we end? Please put those in the chat. No. Okay, so just to summarize, if you are coming into school, you are able to opt into the testing program. Obviously, by doing so, helps prevent any more outbreaks within the school, as we're fully aware how quickly and easily that can spread, as we kindly found out over Christmas. So it'd be good to prevent any of that happening again. So again, this is completely optional. Test packs will be available to collect from the SLT suite tomorrow, should you wish to take part in that. If you do think of any other questions, please do bring them up at briefing tomorrow if you're attending. If not, come and speak to me during the day, but the test kits will be ready for tomorrow. Okay. Thank you very much for your time this evening. Let me just stop recording, and we will see you all tomorrow or when